I'm Dr. Larry Burke, and this video is the 9th in a series from my monthly blog at LetMagicHappen.com. This month I'm going to discuss Chapter 1 from Let Magic Happen, Adventures in Healing with a Holistic Radiologist. Chapter 1 is titled Seeing Inside the Body, and I'm going to focus specifically on the subheading Scanning Not So Normal Volunteers. Back in the early days of MRI, we used to recruit volunteers to go into the magnet and volunteer to be scanned to test a new piece of equipment or technique we were using. And sure enough, every once in a while we'd find something significantly abnormal. And we'd all go, wow, what's that doing there? And it turned out that people around the country were having similar experiences, resulting in a number of papers being published in the 90s showing significant abnormalities in a fair percentage of people of the knee, the shoulder, and the spine. Things like meniscal tears, rotator cuff tears, and disc herniations. These findings were quite puzzling to all of us, and it has implications for when a patient walks into my office for EFT or acupuncture treatment and says, "Doc, here's my MRI scan. This is the reason for my pain." I'll usually respond, not so fast, maybe, but there might be other things going on, such as psychospiritual or emotional issues. Now the connection or correlation between MRI findings and symptoms can really fall into one of four categories, and it's important to know which category you're in. The first category that you could be in is to have positive MRI findings and no symptoms whatsoever. Second category is you could have terrible symptoms and no MRI findings whatsoever. Third category, you could have symptoms of inflammation, and the inflammation may or may not show up on your MRI scan. The fourth category is you've got mechanical symptoms in a joint or a spine, and we find an obvious explanation on the MRI scan. So which category you're in has implications as to what treatments might work best for you and how to approach your whole illness. So start with the first category, which is you've got an MRI scan for some other reason, or you're volunteered for something and they found an abnormality. And this is what happened to my friend Dr. Gary Moreno, a neuroradiologist back at the Pittsburgh MRI Institute. We put him in for a scan of the cervical spine, and sure enough he had a big disc herniation bumping on his spinal cord, but he had no symptoms whatsoever. We were all quite surprised by the findings, and thinking of the long-term implications of that. What if he develops symptoms years from now and has another MRI scan and they find this disc herniation bumping his spinal cord, and now it actually hasn't changed since before when he was totally asymptomatic, so would it be sensible to recommend surgery at that point, or look at other components that might be causing him his symptoms now? Perhaps some emotional trauma that he experienced layered on top of the pre-existing condition. So second category, you have someone like a fibromyalgia patient or a regional chronic pain syndrome patient who has terrible pain and maybe multiple trigger points in their body, yet you do an MRI scan and find absolutely nothing. Now this is a red flag that you really need to address the psychospiritual emotional component rather than doing some conventional means of treatment. So acupuncture, shamanic soul retrieval, EFT, any of these things might be better for that kind of a situation. Third situation is one that I was in where I had bursitis in my shoulder. The MRI scan, in the early days we really couldn't tell whether there was any inflammation there or not. I tried non-steroidal anti-inflammatory agents, got terrible side effects. My mouth ulcerated to the point where I couldn't eat or speak. And when I finally figured out, well, the drug is causing this, I went off the drug and then wound up having surgery for an inflammatory condition, and they resected the bursa, but yet my symptoms really never went away, and it was years later when I figured out that it was connected to anger issues that I had at the time and continued for many years until I was able to learn how to release them. So that's a situation when we're in inflammation. You really want to look at some alternative treatments like acupuncture, herbs, supplements, as opposed to having surgery for an inflammatory condition which might only make it worse, or unless you've got an infection that needs where there's an abscess that needs to be drained. That would be one of the surgical indications for treating inflammation that way. And then, of course, if you go the drug route, you might wind up with side effects and complications. So the fourth category is now mechanical symptoms, such as you have a meniscal tear with a piece of meniscus floating around in your knee, and we can find that on the MRI scan, and removing that piece would resolve some of your symptoms. Or you have a large rotator cuff tear where your tendon has been avulsed from the greater tuberosity and needs to be reattached surgically to regain your strength. Or a large disc herniation that would be causing, in the most extreme example, bowel or bladder dysfunction, or extreme weakness and inability to walk. Now, in some of these categories, there might be a degree of inflammation on top of the mechanical problem that can be addressed with alternative means. And if you're going to have surgery, you might as well do the alternative process as well, because you're going to handle whatever emotional underpinning there is for the situation and get a better result from the surgery. In some cases, you might even be able to avoid surgery altogether, as Twyla Williams, my patient in Chapter 11, did with acupuncture. She was able to reduce the inflammation from her bursitis in her shoulder, and even though she did have a rotator cuff tear, she was able to go back to work with only minimal loss of strength. And of course, in many disc herniations, there's inflammation that occurs in and around the adjacent nerves, which can be treated and sometimes will reduce the symptoms to the point where you can wait out the disc herniation and wait for it to shrink up, which many of them do it with time. So those are your options in the 4 different categories. And again, it's important to figure out which category you're in so you can make rational choice of treatment decisions and how you're going to proceed, preferably starting with the least invasive, progressing to the most invasive choices. I'm going to discuss many other issues related to this topic in future videos, and also it is discussed already in the book, particularly in the chapters and exercises that address symptoms as metaphor, such as, in my example, my shoulder with anger being a metaphor for inflammation in my shoulder. And those kinds of topics are very interesting, and I look forward to discussing those in the future with you. Again, you can order my book from letmagichappen.com and go to my Amazon page, and you can get an ebook, a paperback, or a hardcover edition. So look forward to talking to you about Chapter 2 next month. Let Magic Happen. Thanks.